uncover the essential elements of how to transform healthcare from the fundamental way of how to create that quality, authentic patient to provider relationship to the importance of having passionate drive for the people that you serve. Discover how to overcome challenges within our own fear and those of others to really move things forward and drive the internal motivation and engagement from the patients, your team, and your company in general, and how to collectively come together for the betterment of them all. Healthcare entrepreneurs, are you ready to rewrite the rules for your business so you can have more time off, a great team, and more income while creating a positive social impact? Then you are in the right place. Welcome to The Provider's Edge. I'm your host, Sabrina Rumbach. I'm a provider, an international peak performance keynote speaker, and a best-selling author. Let's open the gateway to profitability for you today. My guests and I help healthcare entrepreneurs and startup founders like you break through barriers so you can control your business, control your life, and control your future. This is your defining moment to be a disruptor in healthcare. Welcome back for another episode. This is your host, Sabrina Rumbach, and today we have Dr. Carl Lavorata here with us. He's a dentist, graduated from Georgetown University School of Dentistry back in 1987. Oh, wow. That's the year I was born. And he has been practicing general dentistry in Smithtown, New York since 1988. And he's also the director of Clear Fusion orthodontic appliances as well, in the senior advisor and dental director at Phoenix Capital Advisory, where he reviews healthcare innovations. We know healthcare going at the speed of healthcare, but technology and innovations are much faster. And how do we adapt, assess the best ways to really improve all of our work as practitioners, our patients? And that's why we have this show to really celebrate and give the wins that so deserve and learn from each other and how to best serve ourselves, our team, and our patients going forward. Thanks, Dr. Carl, for being here.
My pleasure, Sabrina.
I believe we connected a little bit a while back and talking about your work and wanted for you to share this journey that you had. So what was some of the initial passion or thoughts that drove you into dentistry?
I came into the world to want to serve others. Dentistry, I guess, turned out to be just something that came about. My heart just drove me to that for some reason. Now I see why, obviously, but you never know why when it's actually happening, but it was probably predestined before I even went into my mom's womb. How's that?
So you're saying since it's destined and now you know why. So what's the most strong connection that you felt now that you're in it for so many years, that you've been doing various leadership position plus running, evaluating innovations? How does that all come together?
Well, again, my main thing is really being a dentist, caring for others. Everything else is an offshoot of it, but caring for others is probably the most important thing and the thing I do best. Anything else I've ever done, nothing comes close to that. Other than I would say my family, naturally. I care about them too as much. But my patients are also my family. You know what? A success is personal happiness, professional happiness, and financial security all together. Dentistry brought me all that. And the professional happiness part is big. You know, I live in Florida. I fly to New York every week to work 3 days, 3 hard days. And why do I do that? Why would I go out of my way for that when I could probably just retire? Because I love what I do. And my patients would be upset if I just left. So I stick around. I do it. Being the best takes a lot. It's not just saying it. It's taking a lot of continuing education over the years. Being a dentist where people actually have to open their mouth and we work there, it involves a high level of trust. So my patients actually enjoy coming in. They have a good time. I know how to joke with everybody. I'm not one of those woke practices of today, maybe, but I have fun with everybody. And yet I could probably be one of the best there is at the work. And as much as you were talking before about technology is good and bad. Some of the technological innovations are great, but there's nothing like knowing what you're doing and being able to share it with your patients. And that's what I get. I'm the happiest I could be. And by the way, every day I'm working, I do some charity every day for people that can't afford. So I'll do it. I do it every day. All my life, I've done it every day, and I give back. And why? Because I could. It's that simple. Everything else doesn't matter if you don't give back a little. And I give back a lot. I enjoy it. So I have a great time as being a dentist. So that's why I'm a dentist.
Yeah, I think what you said was very crucial on the human part, because we got into medicine. Most of us understand at the end of the day, it's a service type of business. It's about building those human to human connection for our patients to trust us enough. So when we do give them and offer them some type of treatment option, they will be able to say yes instead of worry about what's going to happen, whether that's after procedure pain, complications versus the decision they have to just simply being in the office, not able to take off work for some other people, right? And at the end of the day, it's about having that relationship, and you use humor. I believe some of the studies saying humor is the best way to connect with people because it breaks down the barrier of someone who just as an authority figure and telling them what to do, but really truly be there for them and understanding this circumstances. But of course, nowadays it has been more difficult in practicing altogether because it seems like some practices or people are just overworked in general. So they are so tactical, focused on just doing the job instead of how to connect with the patient to have that customer service journey, right? That relationships part, instead of just focusing on what are you here for? Let's solve it and move on. And do you see that as some of the challenges that you see from both your practice or your colleagues?
I agree with everything that you were saying. I think the biggest challenge in medicine in general today is that we're losing focus on what matters. Now, it used to be always people worked hard at school. Your education, you were wiped out. I mean, my education was 7 days a week, 20 hours a day for 4 years. All right. The education is down. The curriculum's nothing like it was. People are coming out of school heavily in debt because the price of that education went skyrocketing since guaranteed student loans took off. And the young people coming out of school used to buy the old timers out. They can't anymore. And corporations are buying up all medical and dental practices and veterinary practices. And the business model is changing to an insurance-based model that lets insurance companies dictate what's done on a patient rather than the doctor-patient relationship where the doctor examines the patient, sees what they need, want, and accomplishes that. Things have changed. And, when You go to your doctor. If you're sick, you call. They'll tell you to come in 3 months. And you just look, and people are just going to walk-in clinics every day now. The personal touch is gone, or it's going. And it's a shame. But that's, so all the technology in the world doesn't matter. Everything like that doesn't matter. What matters should be doctor-patient, relationship, care. And that's what we're, does everyone say they do that? Of course. Do they? No. Things have changed a lot in that respect. And I wish it didn't. If I had my one wish, it would be back to the way it's supposed to be. But as far as I'm concerned, I won't sell out to one of those DSOs, any of those corporations. I won't do that. In fact, I'm in the process of mentoring a young guy to hopefully I could make him into what I was, who I am. That's the most important thing.
Right. It's passing down the baton. How can we do it in our way to best serve our community without having to feel somewhat of a security blanket of being with a large organization, because there are multifaceted in running a practice. It's not just seeing patient anymore. It's about that continuous follow-up, patient coordination, and figuring out what else with their social determinant issue that's preventing them from taking on the advices. And also, how can we make sure they continue to come back to the office when they need to, instead of, oh yeah, I need to do that, but life got into the way and something completely shift their mind, shift their priority, and they forget about their health altogether. And definitely we are seeing a number of private practice going down year after year. And it's about how do we grow in our own entity? And sometimes, yes, it's about mentoring the next generation and then other colleagues that can take on. Other is about leveraging the right technology. Not all things help us, right? Like just because EHR system is simply a documentation and ordering. It's not for patient engagement per se. Yes, we can use some of the data to risk stratify to kind of understand the pattern, but it still need to be more optimized way to engage and reduce the workload that we have and among our staff, so they can actually pay attention to what the patient needs. Definitely from what you mentioned, educational side, from how we run things, how we believe what could we do, right? Like we are actually having more control than we think we do. And if we continue to not allow our environment to dictate us, but we work with the best resources and make the system work for us, that's the shift that we can do on the daily basis. And sometimes it can be a very small shift, but at least that shift can continue to help us going forward. So what are some other things as you go through all these years of running your practice and having really being a nonprofit, right? And I think that's the idea I have heard other physicians do is they create their own nonprofit. So when patient couldn't pay, and then they're able to still see these underserved patients and people who has low access to care. And then what are you seeing on something really worked well with your own practice?
Well, like I told you, I always do a little charity every day. I will tell you that the dental practice in general, in fact, before I say it, why don't I ask you the question? What do you think my overhead is?
Well,
just give me a percentage of what I bill, what I bring in, and what do I actually profit? What's my net profit on anything I do? Would you have an idea?
I'm not so sure about dentistry, but I'm hoping that you're having at least 40% net profit.
Not even close. It's like about 75% overhead. It's about 25, maybe 28% net profit. That probably, and especially since COVID, everything went up drastically. I didn't even raise my price. I'm probably at close to 20% profit right now. However, if you do real well, the 20-something% profit is still profitable if you do real well. And the biggest overhead, by the way, in the dental office is really your staff, your salaries. And you got to take care of your staff. Very important. But I never really, I'll tell you the truth, when I walk into my practice, some people, a lot of continuing education does have to do with running a practice, or reduce your overhead, do this, do that. You want to know something I never do? I never did. I don't even think what I do is a dentist. I pray every morning before I start work. I ask God to, guide my hands, my eyes, my brain, and I do what I have to do and just have fun doing it without even thinking. Same thing with running my practice. I could probably run it better, whatever, do all these little points to, bring out the better, but really doesn't faze me one way or the other. That lack of a strong net profit doesn't prevent me from doing something if I see someone needs something that they can't afford. I mean, I used to, a few years back, we had like one homeless guy in my neighborhood. I'd have my friends go pick the guy up and bring him to my office, and I made him teeth. He had no teeth. He couldn't eat. And, after I finished and made him the teeth, we went out to White Castle to celebrate, the New York thing to do. When that man was, when it was like 0-degree nights, which not too often in Long Island would you have 0, -5-degree nights. But when that happened, my son would come in the car with me, would find him, would drive around until I found him. And I'd take him to a hotel room for how many nights needed until that cold would break so he wouldn't freeze to death during the night. I mean, that's, to me, that's more important than all the money in the world. So I never think. And the law of karma states that if whatever you give without thought, more comes to you all the time. And I learned that early in life, I guess, from my dad. So I don't think about profit, loss, net, this and that. It is a high overhead of the dentist's office, but I'm always blessed. So I never think about it. And I think that the old-time practitioners didn't either, for the most part, from what I remember. I think today, especially with the higher price of everything, everything's gone up. I do think people think about it too much. But a profession where you're to serve, it's hard to do two things. Do you want to serve your pocket or do you want to serve the people? And it's hard to really do it. If you're doing something very valuable in service, you're going to get paid. And if you're going to get paid, you're going to do well, which I do. And I'm not saying I don't. I just don't think about it. I'm blessed not to have to think about it.
Right. I think that's the key thing is if we keep the positive mindset of I continue to do good, I'm also attracting good. I'm doing the things what I need to do. And therefore the word of positivity, the sense of who we are, that's how we continue to keep the door open, to have people continue to want to come back because they know the level and the quality that they are able to receive. And that's what they want. Their family and friends all have the same high quality experience.
I want to just say quality comes from 1, education, and 2, continuing education. Patients sense if you have it or not. They sense it. They know it. And quality is important.
Right. And quality is not just us as providers, but also trickle down to our entire team. And I have a personal experience where gone to one of my doctor's office, like him a lot, but the front desk girls and the checkout girls you just sense the bad attitude. Never gone back before. And you hear the same story over and over again. So we know it's not just us, but it's a whole office, a whole team base. And that's why our staff overhead is so high. And it's because we wanted to keep the good people. We want to continue to train them. And then something that I continue to train practices and healthcare organization is on how are we understand individual drive. How it's not all about external motivation, right? Oh, the bonuses, the autonomy, and the XYZ. That's only short-lived. And if people continuously driven by the title, the bonuses, they actually just, once they hit that goal, they kind of plateau instead of understanding how they want naturally be appreciated, what they see their career go, how they see the value of aligning with the whole culture. That's the most important thing. And you wouldn't be able to know that until you actually have deeper conversation with your staff. And actually, when they become honest with their challenges, you know how to respond to them, and not seeing it just a business transaction. Would you see?
You know what I'm thinking, Sabrina? Took me a while to realize, why you really, I just realized this whole podcast thing is nonsense. That you faked it just to really get an interview with me. All right, I'll consider hiring you. You have to move first to Long Island. But if you really want, I'll consider hiring you. Is that what this was about?
No.
All right, you got the job. You want to help run an office? Is that what you wanted?
No. Like my actually,
this is real? This podcast is real?
My podcast is real. We have 130 something episodes. I have more episodes to publish all the way into June of next year now.
My wife says, I said to her, I'm going on a podcast. She goes, you don't even know what a podcast is. I said, I know. I don't know what it is.
It's pretty much online radio.
I thought you set me up that you're trying to get a job from me or something. All right.
So it is online radio that people can actually listen to it for various period of time because it become evergreen. When people subscribe, they search for it and they understand how someone like you who has been in the field for so long have perhaps a similar perspective, and then help them to validate their concern, help to also align with, okay, I am doing the right way, right? I don't have to buy into the larger organization, and I can find the right help, the right people when it's needed. And then, of course, I'm always in a position of, doesn't matter if I can help or people I connected can help. We're all just learning and growing together collaboratively. I actually don't run people's practices. I only come in as like consultants if people need it from the productivity standpoint and patient engagement standpoint, because I see I got burned out early on in my career, working 80-hour days. Don't say no to any patients, add them on right away for surgeries or consultation. But then after a while, when you start changing the whole staff, changing the dynamic, and we know the restriction. And so instead of thinking about how the system never worked for us, we start creating the system that works for ourselves.
When you were saying how you went to that medical practice and they weren't that nice to you at the front desk. I mean, 2 different oral surgery practices near me. That one staff are totally incompetent, to say the least. But then there's also one down the block from me, and I like them too. Well, I like both. And I walked in maybe about a year and a half ago. I ran from my office just down the block. I had to pick something up. And the girl yelled at me at the front desk to put my mask on. But if I had my mask on, I couldn't tell her who I was and what I was there to pick up. And she yelled at me, and I just left. Called my friend up, the doctor there. I said, your front desk girl yelled at me for not wearing a mask. And he probably went over there, and when she realized who I was, you saw her face like turn blank. I give them so much work. That's the last thing that I'd want one of his staff members to do to me. But there's a lot of attitude today. COVID kind of scared a lot of people off. I can't even, for the first time in my life, as a dentist, I've had a hard time hiring somebody. I think I finally did. But really what happened is a hygienist of mine for 28 years about that I sort of helped raise her. At 50 years old, she came down with a very bad cancer. And I do think, she came yesterday over to my office. I mean, I'm hoping she's going to be okay, but a very devastating form that she has. And while they got the surgery and actually got it out, it's one of those that it's a dangerous one. And for the last, I would say since September, when we found out really the diagnosis, she told me I had to find someone permanent. And no one even, you put the Indeed ads, they send you the resume, they don't even answer the phone. No one even wants to work. And it's not me alone. I've called up no one could find workers anymore that want to work. COVID kind of ruined a lot of stuff. Unnecessarily too, but
you're so right. It crossed every single specialty. People's been telling me that.
In medicine, it was bad. Yes. And it actually, we talk about that doctor-patient relationship, and not for me, it didn't, but for everyone else, it did. I even flew in every week during the lockdown. I flew in every week. I was like one of 3 people on a commercial plane. I thought I was the president walking around having fun, but I flew in every week in case my patients had an emergency. I wasn't allowed to do regular work, but I still wanted to be there if my patients needed me. I wasn't letting them go to a hospital or something. And you know what? They definitely overinflated it. I know it was a bad virus, but I got my theories on how it happened, but I also have theories about, maybe one of the side notes of something that I instill in a patient or friends or anyone that I know is if I were to say to you, if God is unconditional love, I'll ask you, what is the opposite of that love?
Everything is a value exchange?
No. What's the opposite of that godly, unconditional love? What is the opposite? It's used every day on smart people try to use it on others every day. The negative side of it. What is it? Fear.
Yeah.
Fear.
Yes.
Fear. And can't live on fear, but people do. And it was a great thing for government to instill fear on everybody, and everyone's instilling fear on each other. It's the worst thing you could do. It's the worst thing you could do. And it's used in politics every day. Vote for me. They're going to have you lose your Social Security benefits. All the old people get scared. Oh, if I vote for this one, he's going to take away my benefits. Things like that all the time occur. It's used in religions, it's used in marketing every day. It's used in everything. But when people come into my office, there's no fear. Even the worst thing I could fix, no matter what. There's nothing to be afraid of. Can't fear anything. And that virus, that brought out fear in everybody. And it's the wrong thing. When I was going to dental school, you know what the fear was? HIV, AIDS. And they asked, do you still want to go to dental school? We just isolated the virus in people's saliva. And, they didn't know whether it was infected that way. And that was the advent of the gloves, mask, glasses, safety glasses. That was the advent of it, was HIV. Because dentists didn't know if you're going to get it just by working on someone's mouth. Turned out not to be, and I said I'm going to be a dentist. I didn't care. I wasn't going to let the fear ruin it for myself, my soul, and what I came to do. So fear is the worst thing. Same thing happened with COVID recently. They put a lot of fear out there. How did most people died from that? Really putting them on those ventilators. That's what killed most of the people. If they didn't do that, most of the people would have stayed alive. But if you're about to go on a ventilator, you can't breathe good. You're going on a ventilator. They're ready to do that, and everyone's in a hazmat suit. What is your first thought to yourself? I'm going to die. And sure enough, you could put that into your head and think that that's it. And you might even cause your body to do that.
Right.
They refused to give steroids that would bring the inflammation right down and have people breathe again. They refused. Now they know you can do it. And the big joke of it, that they were saying you can't do that. It's all about fear mongering and all. But fear is no good in anything. And it's used by people all the time. And I don't like when someone tries to, put that on me. I don't let them. But I do see it scare a lot of people.
Right. And I think what I come out of that point is that we have to think about how can we love more? How can we love what we do? How can we love the staff that we involve with? How can we support them and love what they are going through? And also just give the love back to the patients who have various struggles. We will never know how they got through it, and but we can be there to support them when they come.
You asked how. The answer is if you remember who you are, if you remember where you came from, and you remember everyone is related to you because we're all one family, you start to then you could love better.
Right.
But you have to block out everything that anyone else says and just remember who you really are.
Right. Truly.
Meditation every morning.
Believing in your values. Yep. Definitely that's some amazing tips. Thank you for sharing these. Going around from the changes, a little bit of history of medicine.
If you change your mind and want a job, let me know.
Well, I appreciate you for sharing your story and the challenges we have, how we're changing medicine and how we're just being a human at the end of the day. And don't overcomplicate things and simply thinking everybody else around us, just another human like us. We all have our own struggles, but we're all here to contribute something different. And that's all we can do as the individual practitioners, healthcare workers, and then just technically a friendly neighbor when you're seeing those who come into your office. So appreciate you. And then until next time, everyone.
Take care, Sabrina. Nice talking to you.
Thank you for listening. Remember, the positive change we're seeking starts right here with me and you. If you're a fan of the show, or if you are just having struggles or success that you're either experienced in the past or are experiencing now in the healthcare industry, these matter to all of us. I want to hear from you. Visit sabrinarumback.com/connect and send me a direct message. Talk soon.